guys, welcome back to my channel. It feels weird to say that because I feel like it's been such a long time since I've talked to you guys. I'm going to update you guys on what's been going on, why I've been gone for so long, how I finished my OB semester. I have so many things to catch you guys up on. I'm so sorry that I've been away from YouTube for a while, but I am back. I'm ready. I have so many video ideas in mind. I have so much going on. I promise you, I just started summer last week. So expect many more videos to come from me. I am taking an online class, but thank God it's just like a government class. So I have a lot of time on my hands to be recording lots of videos. So today I'm actually going to be answering your guys' questions. I asked you guys on my Instagram, which is going to be right here. It's just called Nursing with Jackie on Instagram, obviously. I asked you guys if you guys had any questions related to being a nursing student, any questions that you guys have about anything related to nursing, questions that nobody really talks about. It's just, I don't know, kind of what to expect if you haven't started clinicals yet. What can you expect? I like that. So I'm going to be answering your guys' questions. So if you'd like to see that, make sure you stick along with me. Make sure you subscribe if you haven't already. Make sure you like this video. And yeah, let's get started. Okay, so the first thing that we have to talk about is this shirt right here. So it says love, obviously with a little heartbeat. And then it says it's a nurse thing. You guys, I am absolutely obsessed with this shirt. Like, I don't even know if you guys are going to be able to see it or if I'm going to be too close to the camera, but this is literally the softest t-shirt I have ever worn in my life. It is so cute. I've already gotten so many compliments on it, and the company that actually sent this to me is called Thread Tank. I'm going to link them down below. I'm going to link this t-shirt, and I'm also going to insert a little video of me wearing the other t-shirt that they sent me. So you guys can see them, but these are seriously so pretty. I'm actually gonna screen record this t-shirts that they have online. I absolutely love this company. I love supporting small businesses. It's one of my favorite things to do. That have such a great impact and have such a great story behind their company. So I'm gonna show you guys all the t-shirts that they have, but this is my favorite one by far. And I wanted to get other nursing ones because they gave me the opportunity to get other nursing ones. But since I'm not a nurse yet, I didn't want to get them because I don't want people to think like, oh, you're a nursing student wearing nurses shirts. But as soon as I become a nurse, you best know I'm going to be buying all those nursing shirts. So I'm going to link them down below. I also have a coupon code, which will also be listed down below. I'll probably have it here on the screen as well. But yeah, let me know if you guys buy a t-shirt from them. This is not paid, by the way. They were kind enough to send me the t-shirts. I absolutely love them, so I decided to share them with you guys, of course. So yeah, make sure you check them out. Okay guys, so as many of you guys know, if you guys consistently keep up with my videos or you keep up with my content, you guys know that I kind of took a little break from social media. That includes Instagram, that includes my YouTube, and the reason for that has been that my grandmother passed away. I don't think I've ever actually talked about her on my channel, but my grandmother did used to live with us and I had to take care of her every day. And she got sick with pneumonia. I took her into the hospital. A couple of weeks ago, and she just wasn't responding to treatment. She was 86 years old, and she unfortunately passed away. So that's been something that I've been trying to go through. It's been a couple of weeks now. It's still been really hard, but I'm just trying to, of course, keep pushing by, but that's the reason why I haven't been so active on YouTube. On top of that, I've also been finishing my OB finals. So I was finishing those exams, which thank God I finished with an A and a B, and I'm planning on making another video related to my OB clinicals and theory and kind of sharing you guys my tips and tricks on my studying and what actually helped me. After that last video that I made, I actually started doing something a little bit different, and it actually helped me a ton. So I can't wait to share that with you guys, but for now, I'm going to be answering your guys' questions. So yeah, I got so many questions from you guys on Instagram. Like, I can show you, like, I have a lot of questions to answer. So this might actually be a two-part video. Not sure yet, but we will see. So let's get started, right? Let me get some coffee first. Okay, so starting off, the first question is going to be, what was something that shocked you the most? Something that shocked me the most being in nursing school was probably the questions and the exams. I feel like nothing in the hospital has actually shocked me as much as like the actual nursing school has. If you guys are in pre-nursing school, if you guys are taking pre-nursing classes, you guys know that, yeah, those classes are really hard, but a lot of it is all knowledge-based, just like everything else that we've basically done throughout our entire school. And nursing school is something that like was a complete 360. So I was an A and B student before I started nursing school. I did really well in school. I'm really good at memorizing stuff, and then going into nursing school and taking that knowledge and trying to turn it into application type questions has been really hard for me. My first semester I actually struggled a pretty good amount because the amount that you study in nursing school does not equate to the grade that you get. Just because you can study and you can know this material like the back of your hand, you can know it 100%, and that actually does not guarantee that you're going to do well in an exam if you're not able to apply those questions. So that's definitely something that shocked me the most, because before I started nursing school I was like, oh, I'm going to do fine. You know, everybody says that it's really hard, but I'm like, it's okay, because like I'm really good at concentrating and like sitting down and taking my school very seriously, and I know that I can put in the hours and I can put in the work and I'll do fine in nursing school. But that's definitely something that shocked me the most, is the NCLEX type questions. So what I've had to do is throughout my nursing school, I've had to do a trillion NCLEX style questions, just because it's so different trying to apply the material into these situations, into these case studies. So that's definitely been the hardest thing for me. Was there ever a moment that you thought, this isn't for me? No, I have never had a moment in nursing school where I thought maybe I can't do this, or that this isn't for me. I've like been so excited for nursing school ever since I decided to go into nursing. I started watching a bunch of YouTube videos, started looking at a bunch of blogs online, and I was always super excited to be in nursing school. And since starting nursing school, even though I struggled a lot in the beginning, there was never a moment where I was like, maybe I can't do this, or maybe I'm not cut out for this. It was more like, oh my God, this is so hard, but I couldn't imagine me being anywhere else. I couldn't imagine studying anything else. I feel like this is definitely a calling, and if you don't enjoy this material, you're not gonna enjoy the job at all. And even being in clinicals, even having patients that treat you not so well, or that think that you're there to serve them or stuff like that, I feel like nursing, you have to be very selfless. There has been like clinical rotations where I'm like, this isn't the field that I want to go into related to nursing. Like, I always thought that I was going to be a pediatric nurse, and then I did my pediatric rotation and I was on the hemonc and the oncology floor, and definitely not for me. I always thought that I wanted to do pediatrics, but I don't know if it's because those two floors that we were on were so draining. They were so like mentally, if it's just hard, you know, like seeing kids struggle and seeing kids sick, that's something that you know, it's really hard to go through. It's really hard to like take care of kids that you know aren't doing so well. So that I definitely have had moments where I'm like, this isn't really something that I want to do. Just like med-surg isn't really my favorite. I could definitely do it. Like, I wouldn't mind doing it. It's just not my favorite. I've just loved labor and delivery, and ever since I've done labor and delivery, I'm like, this is it. What were my hardest classes? So I think that my hardest classes were foundations, which is the first semester of nursing school, just because the material wasn't hard at all. You're learning a lot of safety stuff and you're learning a lot of basics of nursing school. It was just the transition of questions that like threw me off. That was, I think, one of my harder semesters. And now looking back, it's like, the material wasn't hard at all. It was just trying to practice those NCLEX style questions, which I didn't know how to do that back then. Like, I thought that I just didn't study enough, even though I knew the material like really well. I just didn't practice enough questions in order to grasp the idea of the NCLEX style questions. But other than foundations, I think med-surg was definitely my hardest class, just because I did a lot of concept maps, but a lot of the diseases in med-surg they're related to each other like really closely. And when you're doing like a lot of GI stuff, a lot of them have the same signs and symptoms. They have the same labs that change and all that. And like while you're taking your exams, you have to try to like differentiate what disease you're talking about in order to know what interventions or what complications can occur from that. So I think that med-surg was probably my hardest class. Personally, I didn't do terrible in med-surg. I actually did okay in med-surg. I think I ended up with a B. If not, I ended up with like a 78 or a 79, which you guys know I'm very honest about my grades. I'm not perfect and I'm not pretending to be perfect. But yeah, that was probably my hardest class. The next question is, how was my first time vaccinating or putting in an IV? If I have not done an IV yet, which is so frustrating. I've been wanting to do IVs, obviously, since we learned how to do IVs, but I've not been able to get a good patient to have an IV. It's always an elderly patient, and they always require a sonogram guided IV, which means that they have to call a sonogram, like a specific IV nurse to do it, because the bedside nurse doesn't feel comfortable sticking in an IV because she can't find any good veins, which is so frustrating. But my first time vaccinating was actually, it's kind of funny. My first time vaccinating was in med-surg. I remember I was so scared. I actually did it in the deltoid muscle, and I remember that I was super nervous to do an IM vaccination, and as soon as I was gonna do it, I was already super nervous because I had already done sub-Q, which is like insulin and stuff like that. I had done that already, but I remember my first IM shot, as soon as I was literally getting ready to stick it in, my nurse goes, make sure you dart it in, you have to do it really quick. And I don't know why her saying that to me, like right as I was gonna put it in, made me so nervous. I like started sweating, and I was like, and I was just holding the needle. Like, patient was right here. Thank God it was, not thank God, but it was actually an elderly patient that was very confused. She had no idea what was really going on. And when I was just giving her the flu shot, and I don't know why my nurse saying that just stressed me out, and it made me rethink like my whole life. So like I was sitting there, and for 10 seconds, I was just looking at her arm. I had already cleaned it and everything. I knew where my spot was. I already hit my landmark. And just because the nurse said, make sure you dart it in there really quick, you have to go quick, that stressed me out. And like I held it for 10 seconds, and then I was like, can you do it? And she was like, no, we're not leaving until you stick that needle in there. And I was like, okay. And of course I'm so thankful that she let me, that she like made me do it, because I ended up doing it. It was just fine. I don't know why I overthought it. It's so funny, like when you first do things in nursing school, you feel like you're gonna be such a fail at it, and then you do it and you're like, damn, that's what I was nervous for? That was really no big deal. The next question is gonna be, what happens if you don't have a good GPA but still wanna get into nursing school? I'm struggling. So, let me tell you something. A lot of you guys don't know, or many, I don't know if you guys know, but if you guys got to watch my Get to Know Me video that I posted, I actually applied to nursing schools, a bunch of like university nursing schools in Texas that I had specifically picked out related to what classes I had taken. And I think I applied to a total of 3 or 2, I can't remember, and I actually got declined from all of them. And once that happened, you know, I don't know how it is in every state or how it is in every school, but at least here, you had to wait a whole semester before you were able to apply again to a different nursing school. So once I got declined, I sat down and I'm like, okay, well, I don't know how I feel about retaking my T's. I don't know how I feel about retaking any classes because my GPA was not bad at all. I think I had like a 3.4, but my T's wasn't as high as it needed to be. I took it. The thing is that I took my T's right after 2 summer classes. I took AMP1 and AMP2 during the summer, and then right after I finished, literally 2 days after, I decided to take my T's. So I didn't take any time to really study the material, but either way, I got declined from all these universities. So once that happened, what I recommend doing if you're not doing so well in school, start looking around. Either, the thing about this is that private colleges that have nursing schools, you need to be very, very careful, just because I started looking at different private universities, and let me tell you, they're not cheap. So it depends how bad your GPA really is, or how much you really want to get into nursing school, or what your situation is. But if you're going to be looking at private universities like West Coast University, when I went in, I think they told me it was going to be $100,000 for my nursing school, and I actually think that I agreed to paying $100,000 until they told me that since I had no credit history, I had to take out a loan in my parents' name. And that was the reason why I actually did not go through, and I thank God that I didn't, because that is just a ridiculous amount of money to get into nursing school. So what I didn't know was that there are many different community colleges that actually have nursing schools. They have nursing programs. I had no idea. I started reading nursing blogs. I started reading, people have a bunch of forums related to nursing within my area. I would literally Google whatever community college was next to me nursing program, and if they had a nursing program, I would look up a blog related to that and talk to people that had already applied, how they got in. There's also Facebook groups, like my school has a Facebook group, and many people that are planning on applying, or many people that are getting into the program, they ask for advice on that Facebook group, and people give them so much information. So just do your research, see if there are any community colleges around you that have a nursing program, and please do not discourage going to, you know, getting your associate's degree in nursing as anything less than a bachelor's. Usually, if you finish your associate's degree and you begin working as an RN, at least where I live, you get paid only 50 cents less, and the hospital pays for you to get your bachelor's online. So it's a really great route that not many people know about. I know I didn't know about it, and I was very ignorant about it when I first heard about it, because in my mind, I'm like, no, I need a bachelor's. I need a bachelor's. I need to go straight for my bachelor's. That nursing school is not going to be good enough for me. That nursing school is probably not going to be good enough for a lot of hospitals and stuff like that, just because it was a community college. And that was my mistake, because if not, I would have already been done with nursing school, because I would have gotten in way earlier. I'm not taking out any loans. I didn't have to move out of my house, nothing like that. And this is a great community college with a great reputation within my hospitals. And actually every hospital that I've been to, for clinical rotations, they get so excited when they see us, because we have a really good reputation with hospitals. So look around and see what other nursing schools there are. If you are struggling with your GPA and you're not going to be able to get into a university, that's something that you could do. And it might take you a little bit longer, but at the end of the day, you might not have to take out any loans, and it might end up being way better for you. I know that for me, I wish that I had known about this earlier, because I would have done it way earlier and I would have been done by now, but that's not a big deal. I know God has a plan for everything, and I'm so happy that this is the program that I ended up in, and I absolutely love it. So I think I am going to make a video about that to answer all of your guys' questions related to my associate's program. But yeah, what is the best and worst thing about nursing? My saddest experience and my best experience. I feel like the best and the worst thing about nursing are basically the same thing. Usually when you're in the hospital, you're taking care of somebody in their weakest point of their life, or one of the weakest moments of their life. Obviously, if they're in the hospital and they're there for a long period of time, they're critical. And I feel like it's great that we're able to take care of somebody in their most critical moment of their life, or one of the most critical moments of their life. So I feel like that's the best and the worst thing, because it kind of sucks to see somebody that either is so young, or somebody that's trying to fight, or anybody really being in the hospital. It's not fun. You know, it's scary. You have to have procedures done. You have to have so many things done, and you have to be picked and prodded, and it's really hard to be in the hospital. But I feel like that's also the best part about nursing, is that you get to try to make their experience as good as they can, and you're there to take care of them, so you can change their perspective on their hospital stay depending on what treatment you give them. So I feel like that is the best and the worst. The saddest experiences that I've had were definitely with my GERE patients, as well as my pediatric patients. I feel like GERE patients and pediatric patients are usually the worst patients when they do get sick, just because of course, their low immune system. And my saddest experience with GERE patients is definitely GERE patients that are like very confused. I remember in med-surg, I had a patient that had a pressure ulcer, and the wound nurse was coming by, and she asked if I could help her clean the wound with the patient. So of course I'm like, yeah, let's go. I'll help you in whatever you need. And this little old man had a pressure ulcer on his butt that was, no kidding you, about that big, and it was necrotized. What is it called? It was like black. And they had to clean up that wound and debride that wound. And that little old man just yelled at the top of his lungs, you know, for us not to hurt him, not, you know, please don't hurt him, please don't hurt me. That's what he was yelling, and you could hear him all throughout the floor the entire day. And I didn't know that it was that patient that we were going to, and you could just hear him like, please don't hurt me, please don't hurt me. And he was just like crying for help, because he thought that we were trying to hurt him. And I would just, you know, hold his hand and tell him, we're here to help you, we're here to help you. You know, we're not gonna hurt you, we're trying to take care of you, we're getting you all cleaned up. But it's so sad, you know, and in general, that's sad in life. And you have, you know, your grandparents that are so sick and confused, and there's nothing worse than being confused and thinking that people are there to hurt you rather than help you. I feel like that's something that's really hard. And then my best experience is definitely having you know, a lot of the times that you're in the hospital and during your clinical rotations, there are some patients that will be there for a very long time. So even though you don't have them for the day, you can still go in there and visit them. And I feel like one of the best experiences is going in and seeing how the patient improves and seeing how much better they are, and having somebody that's just so thankful that they had somebody to talk to that day if nobody's with them, and they had somebody that really cared for them. And one of my favorite things to do while I'm in the hospital is like just give moisturizer and like help clean little elderly people's faces and help clean their hands and put lotion on them, because little things like that make them feel so much better about themselves. And if somebody feels much better about themselves, I feel like they feel stronger to, you know, go through anything that they're going through. So that's definitely one of the best experiences, is just changing somebody's perspective on their hospital stay. So how do I stay so motivated in nursing school? I don't. I feel like it's so hard to stay motivated in nursing school just because it's so hard and it's continuously, you know, like I told you guys earlier in the video, the amount of work that you put in does not always equate the grade that you get. So you can literally study every single day, 24/7, this material, and that does not mean that you're gonna get an A or a B. Just because, like I told you guys, the questions are so confusing, and some people are able to understand them a lot easier. I'm one of the types, you know, I'm one of the people that I struggle a little bit more, but that's okay because I like a challenge and I don't mind working harder for it. I just have to see my end goal, which is being, you know, when I'm in clinical and I get to see what these nurses do, and I get to, you know, hold these patients' hands and I get to help them and I get to motivate them and push them forward. Like that's what keeps me motivated. That's what kind of reminds me of what I'm doing this for. Not only that, I love my little vision board back there. It kind of also motivates me to push harder, and my family, of course, motivates me like crazy because they're so supportive. So did I ever have to do a practical over general anatomy or the bones? Yes, of course I did. I had to do anatomy 1 and anatomy 2, and I did practicals where you get that pretty little sheet of paper that says 1 through 100 with no words and nothing on it. And you had to go around in stations and you had to figure out in a little sticky note, what bone is this? What muscle is this? What nerve is this? Definitely had that, went through that during the summer, which was even tougher because I had no time to study. I literally lived and breathed anatomy. And, but yes, I had to do that. How did I prepare myself to start nursing school? I didn't really prepare myself. I remember when I got accepted into nursing school, I applied for I like added the Facebook group of all the previous classes of my school, and people were asking, how do you prepare yourself? How do you prepare yourself? And a lot of people were just saying, please just enjoy your time, because once you start, you're not gonna stop until you finish nursing school. So I truly, I can't lie and say, oh, I did practice questions or I did this or that, because truly I didn't. I didn't do anything. I just kind of enjoyed the time that I had before I started nursing school. Were you nervous around your first time around blood and inserting IVs? No. I don't have a problem with blood. I don't have a problem with inserting IVs. I don't have a problem with surgery. That stuff doesn't really bother me. What makes me nervous? I don't think, seeing things don't make me nervous, but like, of course, the thought of me doing things makes me nervous. So, but yeah, like I feel like I've seen so many people insert IVs, and I've watched so many videos. Like I follow an Instagram that's only about inserting IVs, just so when the time comes, I'm ready. Did you really work 12 hours without peeing? You guys, yes. Sometimes I literally am in the hospital and you are just so preoccupied, you forget to drink water and you forget to pee. Like I literally could hold my pee in for 12 hours. I did that once, and I like was walking out of the hospital and I was like, oh my God, I did not pee from 6 o'clock this morning and it is currently 6 p.m. How did that happen? Like you're just so busy, your mind is so running like 80,000 different ways. You're trying to put everything together that you learn in clinical. I mean, that you learn in theory related to clinical, and you have to do so much stuff, and you're trying to, you know, do as much as you can. Like you literally just forget to pee. I'm not kidding. But I also don't drink water most of the times that I'm in clinical. That's why I force myself to bring my water bottle. So I do force myself to drink water. But yeah, there's been times that I literally go 12 hours without peeing. Did I feel unprepared going into clinical for the first time? Yeah. I prepared myself and I did everything that I needed to do, but of course you feel unprepared. You just don't know what to expect. Actually, I remember the first time that I walked into my hospital, and the first time that I had clinicals, like me and my classmate, me and my friend, we were like, you know, what can we do? We were even nervous to walk into patients' rooms, like nervous to literally walk in and say hi, or say, hi, do you need anything? We were so nervous to do that. that I remember we were so excited when we got to pass out trays. As lame as that sounds, we saw the lady that comes by to bring trays, and we were like, oh, we can help you. And that kind of eased my way into going into a patient's room. But yeah, of course I was nervous. I wasn't prepared because I literally prepare the crap out of myself before every clinical. But of course you feel unprepared, you know what I mean? You just don't know what to expect. Like, anything can happen at the hospital. You don't know how your nurse is gonna be, you don't know how the doctor's gonna be, you don't know how the patient's gonna be, your instructor, like there's so many things that stresses you out. So yeah, of course, yeah, definitely very nervous. Okay guys, so I think I'm just gonna conclude today's video. I'm definitely probably gonna have to do a part 2 and 3 because there are so many questions on here. And you guys have some really good questions, so look out for parts 2, 3, 4. I don't know how many parts there's gonna be, but there's a lot of questions and I wanna make sure to answer them for you guys. But yeah, thank you guys so much for watching. I really hope you guys enjoyed, and I'll see you guys in the next video. Bye.